always wanted to work for the National Health Service because I believe in it as a service and the ethos of it.
Very focused on improving services for the patients, providing a good service for all the clinical staff that work here, as well as providing a good environment for my own staff.
My main motivations and values for coming to work are predominantly around providing a patient-led service. I get a real sense of achievement through feeling that I come to work working as a multidisciplinary team, providing a better service for patients. I also like some of the challenges we are facing at the moment in the NHS, so some of the immense reductions in costs we're trying to do whilst maintaining the quality of care.
Ultimately, it's about the end result. So I've worked with lots of private companies, banks, utilities and things like that before I joined the NHS. And it's the fulfilment of the end result, which is kind of caring for patients, that sense of public service that personally I get a lot of motivation from.
I think I've always had a kind of a motivation to work for the public sector, and then probably by accident in terms of looking at the training scheme, have started to work for the NHS. But I think when you work for the NHS, you pick up the values of the NHS very, very quickly, and you've got to align yourself with those values. The NHS is a very difficult and hard place to work at times, especially in management roles, because you get a lot of bad press, you get a lot of bad publicity, and if you don't believe in what you're doing, you don't believe in the value that you're adding in this role, then I think you quickly become very dismotivated and really find it difficult to keep going.
I like to be challenged, I like to learn, and I push my team extremely hard and I push myself extremely hard, so I think it's the thrill of doing something pretty difficult or doing things that others haven't done before. I quite like, I'm a bit of an entrepreneur at heart. I'd love to go and spin off a couple of things over here and that, but I think doing things new, innovative, taking an innovative approach is always interesting and exciting.
I think you've got to fit into those values of really patient-focused, making sure that what you're doing, you can see what value it is adding down to the stream, to the end user, which is obviously the patient. So you may not come into the NHS with those particular goals. You may think, oh, it's a good opportunity, but you've got to pick up on those, and you've got to realise you've got to align your goals with theirs pretty quickly, otherwise you're going to find it very difficult.
I think it is the ability to make a difference to patient care and to help staff to achieve their full potential, and I don't think any other employer offers those opportunities at such a straightforward level of being very, very close to the point of care delivery.